Well, good morning, folks. I'm David Hines. I head up the benefits at Metro Nashville Public Schools. I'm actually the other payer in this population here. It's interesting as I look at you guys and I talk to you guys. You know, myself and my peers, we've been working through the insurance companies for years, relying on them to basically work with you, the providers, to get us the deal, to deliver the product. But you know what? It hasn't worked. And there's people like myself that are starting to step up now and go directly to the providers and then turn around to your insurance carriers and say, I'm going to work a deal. You're going to administer it for me and not get in the way type situation. With that in mind, I'm sorry. I was just starting to wax. You want to hit the button, I'll start this thing. I guess I should be nicer starting out. But anyway. Anyway, Metro Nashville Public Schools. I've been in this business a long time. There's been a lot of issues that go on within the system. One of the things that I saw, I take care of teachers in the school board. So with the average age of 42, average age of my mom's a 32, we do a lot of babies. I have a 79% female population. So we did about 250 babies a year. One of the things that are the most volatile in that situation is I was getting tired of seeing neonates show up on my high-cost claims reports. Seems like they were coming along more often, greater frequency and greater cost, time after time and time again. We already had the healthy baby programs. We were already doing screening and coaching, but it wasn't working. Things had to change. So I actually went out to the hospital systems in Nashville. In my opinion, I'm in Nashville, Tennessee. I shouldn't have to ship anybody out for care elsewhere. I have 3 major hospital systems. Somebody needs to step up and help me with this problem. If not, all of them should be stepping up and helping me with the problem. And what I asked them, I said, you know, guys, I want to work with you to improve the overall maternal outcomes. I want to reduce the number of neonates. I want to reduce my C-section rate. I want to see things really improve. Work with me. Let's do some type of bundled arrangement. We'll start first with quality. We'll figure out the cost. You know, cost will come. Quality is what's going to keep my babies out of the neonates that, you know, destroy families and destroy incomes streams type situations. Well, I went out to them and I asked for a solution. And I think at that point I'm supposed to shut up and turn my mic over to Tobin.
That's fine. So, yeah, you can hear me. Good, thank you. I'm Tobin Lassen, the Chief Bundle Solutions Officer for Cedar Gate Technologies. We are the value-based technology vendor that enabled and facilitated these two to really come together to successfully administer a very tailored, cost-effective bundle payment program, and that's what we do. We work very closely with Vanderbilt and all of their departments, accounting, finance, value-based care, all of the different departments there to make sure they understood the bundle definition, how it would work and how it would administer properly. Likewise and simultaneously, we worked with the school district's ASO payer, Cigna, and made sure they could process and handle the trigger claim and pay the bundled payment, because this was a prospective bundled payment program, full upside downside risk that Vanderbilt decided to get involved in this program. And so what we specifically brought to the table was our payment technology. It is a purpose-built prospective bundle claims engine, and we are also a licensed third-party administrator, and we've been doing this now for about 25 plus years, and we make sure all the claims are attributed per the definition to the right bundle, get the bundle billed, paid, and then of course we pay all of the downstream providers, and so that the departments at Vanderbilt could clear off their books the AR. And we also work very closely with CJ and the team to determine what's the best design, how to pay the providers underneath, and how do you manage the risk pool around that. So we work very closely with them. It's been a tremendous experience. Love working with both of them and to bring them together and make this successful. And I'll turn this to CJ.
Great, thanks. Tobin, can you advance?
We'll do it.
That's your slide that you just spoke to. Let's go to the next one.
Got it.
Great, perfect. So everyone hear me okay? So CJ Stimson, I am a practicing cancer surgeon at Vanderbilt. Was operating late last night before I flew here. So glad to be with you guys today. I'm the chief medical officer for our employee health plan. and I'm the Senior Vice President for Value Transformation at the institution. And I was out there in the desert of value-based care looking for David Hines as a partner to execute some value-based care arrangements, and we found each other. And so we created a 12-month maternity bundle, a single price, irrespective of C-section or vaginal delivery, so we take full risk on our C-section rate. And you can see the outcomes here have been, in the first year alone, this is just first year data that we have, we're now in our third year of the program. Our C-section rates were 25% below market for David. We had our own reduction of about 10% within our organization. We dropped his NICU utilization by 16% in that first year. By the way, we don't take risk on the NICU. That's purely just from better care management. That's what we attribute that to. David himself saved about $350,000 on his maternity spend, which is not inconsequential for him, I don't think. And then his employees, the teachers, they saved $250,000 because we bring this maternity bundle to those employees at zero out of pocket. That includes all the professional, all the technical, everything for that year of services. Our net promoter score is through the roof. In the first year, it was 91 for those 100 and some odd patients that came through David, and then the 500 patients that came through Vanderbilt. And it's just been a really great success for us internally as we're trying to roll out value-based care at a large provider organization, $5 billion in patient revenue, 3,000 employed doctors, 7 hospitals. We're trying to get our folks to embrace value-based care, and we've had a lot of success here. We co-created the program with David. We liberated our providers from what I've heard a lot today, all the trappings of fee-for-service utilization management. Under our arrangements, there is no prior auth. That goes for our maternity program, our musculoskeletal program, our bariatrics program, our BH program. We have 8 different programs that are running right now. No prior authorization for that. That gets our providers' attention. And then we really embrace risk. We take full downside risk on all these programs, on all these patients. No restrictions on who gets in, no cherry picking, no lemon dropping, however you want to describe it. The way I sell it to our providers is, are you willing to take a bet on yourself? And if you are, then let's go. And let's go find a provider and a vendor who can help us make this thing work. So we have a minute left. Thank you for your attention. Happy to take any questions.
How did you slow down the contractual, value-based contracts with providers so that the C-section rate did go down? Was there an incentive for that?
Yes, we have an incentive pool that we've created through this program. I will say we went from the provider standpoint, like my partners in OB, let's say, they took zero risk in the first year, no upside, no downside. The health system ate all that risk on their behalf. But now that we're in the third year of the program, in the second year, we went full upside and downside risk. And so we have that now, those arrangements, and those are a joy to negotiate, I'll tell you that. That's what you want your cancer surgeon doing. So, for sure, for sure. Other questions?
Did you see any impact from a care standpoint prior to the program, what the care SOP was for these people, especially with maybe a disparate impact? Look at that piece of it to post. What was different about the care from a quality standpoint or specific care plans, those sorts of things?
So we built the risk structure around what we were doing already in that first year. And so these first year results are really driven by, I think, the high value care that we already provide at Vanderbilt. But what we've moved to in the second and third year, because these things take time to roll out, is really rolling out tools and technologies to do exactly what you're talking about, right? To change behavior so that providers are now aware of what's going on. And to be totally candid with you, we just couldn't handle all of that workload in the first year. The first year, it was just enough to get the value-based contracting right, to get Tobin to do it right, to get David to believe in what we were providing. And so that's what we've done in our first year. But second year, our goal has been really to streamline that quality and to really drive that value equation. And we've seen some success in that. We just don't have that data up here. By the way, we're out of time. Are we allowed to keep taking questions? No one said no. Yes, go ahead.
So hypothetically, if you had to go to a different city other than Nashville, Philadelphia, Houston, pick one, what would you do differently next time?
I'd give more time to figure out the rev cycle. I think that the challenge for us is, and this is my challenge, like I said, my background is not in what most of you all do. It's completely foreign to me. I've had to learn this in the last 4 years. I did not appreciate how important Tobin's work was in getting my rev cycle team to be able to run value on fee-for-service rails. That effort is really difficult, especially when you don't speak the language. Me, right? But yet I'm the physician champion, right? You need me at the table to get the physicians to come along and to get the health system to come along. But that rev cycle finance piece, that was really tough. And I'm glad we had a partner that could help us try to navigate that. I will say, and Tobin, you will agree, hasn't been perfect. It's not easy. They've been doing it 25 years. It's still not easy because you've seen one value-based arrangement, you've seen one. Is that responsive to your question?
Perfect.